Hi, my name is Michael Hill. I'm a neurosurgeon that practices in both cranial and spine surgery. I've been in practice for 29 years. My practice now is oriented more towards spinal surgery. I've done over 500 kyphoplasty procedures in my career. I focus on treating complicated spinal conditions. A kyphoplasty procedure is a vertebral augmentation operation that's designed to treat compression deformities, usually either acute or subacute in origin, that can occur from osteoporosis, spinal fracture, or tumors. The kyphoplasty procedure we utilize is a rapid method of controlling pain in patients. In most cases, the patients will have significant improvement of their pain associated with their fracture within days. Sometimes the pain relief is immediate. The indications to do a kyphoplasty is you want to have a patient that has either an acute or subacute compression deformity, no retropulse bone, and the patient has significant pain that can't be controlled with other conservative procedures. Once I perform a kyphoplasty procedure, the cement hardens within 30 minutes of the operation. So by the time the patient wakes up from the procedure, they have no restrictions to their activities. I allow patients to resume a normal level of activity immediately after the procedure. The majority of patients that we perform a kyphoplasty procedure on notice either immediate or improvement of their pain in a short period of time, which is a great advantage to them in terms of getting back to normal mobility and activities. The risk associated with the kyphoplasty procedure are minimal. One of the risks associated with the procedure is extravasation of cement outside of the vertebral body. There's a risk of retropulse bone, but that's also a contraindication of the procedure. So if you have a patient who has retropulse bone, you do not want to do the kyphoplasty procedure on that patient. The technique that I use for most of my kyphoplasty procedures involves doing a bipedicular approach. So I'll approach the vertebral segment from a bilateral approach by placing 2 Jamshidi needles in through the pedicle into the vertebral body, and then inflating the balloon inside of the vertebral body, and then filling that void with cement from a bilateral approach. That gives me better control of the procedure as well as better filling of the vertebral body. The kyphoplasty procedures are a very safe operation to treat vertebral body fractures. In general, you want to perform the procedure in such a way that you do not allow for cement to extravasate outside of the vertebral body. You want to make sure that you stay within the pedicle as you make your transition into the vertebral body to avoid any neurologic injury. Normally for a Zavation ZVplasty procedure, they have 3 sizes of Jamshidis that you can use for the procedure, which is 13 gauge, 10 gauge, and 8 gauge. More commonly, a 10 gauge would be sufficient for most levels of the thoracolumbar spine, but I'll typically either use a 13 gauge for a small pedicle or a small vertebral body. A 10 gauge is adequate for most segments of the thoracic spine. In the lumbar spine, I'll use either a 10 gauge or an 8 gauge, depending on the size of the pedicle. In most of my cases, I'll do a bipedicular approach. I feel that it gives me more uniform delivery of cement, better control of delivery. In some cases, patients will have an asymmetry to their fracture, and this gives me better control for inflation of the balloon as well as delivery of the cement. To safely access the pedicle to do the procedure relies significantly on having adequate and clear visualized biplanar fluoro. This gives you the visualization of the anatomy that you use to plan your trajectory of the jam sheety in through the pedicle. If you're able to visualize everything well, you can reproduce your results without any risk to the patient in terms of safety or complications. In mixing the OsteoFlex for your use through doing the Zavation ZVplasty procedure, they give you a number of different options in the technology that allows you to have very consistent delivery of the cement. Mixing time is simple with a 15-second mixing. It allows you to have a long working time for the cement, which is about 20 minutes, and it allows you to infuse the cement in a very controlled delivery fashion. I usually have the scrub tech start mixing the cement once I've both accessed the pedicle and inflated the balloon. At that point, I'm ready to have the mix of cement because the next step in the procedure would be infusing the cement into the fracture.
All right, start with that.
The procedure to do the kyphoplasty for a new physician attempting this procedure really relies on good patient selection. And again, a patient with an acute or subacute fracture with no retropulsed bone is a relatively good candidate for the procedure. Once you have the patient on the table, it's adequate visualization of the anatomy, which really gives you the opportunity to do the procedure with very little risk to the patient. And then being very careful about the infusion of the cement using the lateral fluoroscopy gives you ability to monitor your controlled delivery of the cement into the patient. One of the things that I've realized about doing kyphoplasty procedures over the years is it merges the same skill set that you would use for minimally invasive pedicle screw fixation. Those two skill sets complement each other. So the better that you are with doing kyphoplasties, the better you're going to be with doing minimally invasive pedicle screw fixation. What I like about the Zavation ZVplasty system is the number of options that you have to do the procedure safely. They have a range of sizes of the jam sheety going from 8 gauge to 13 gauge. They have different size balloons to use for inflation. They have the curved needle that you can use for access from a unipedicular approach, which gives you a lot of options in terms of what you need to treat the fracture. They have delivery systems for the cement, which uses a manual syringe, and they have the ability to use a cement delivery gun. With all of those options, it allows you to approach pretty much any form of kyphoplasty procedure that you need to do.